Hello and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each Wednesday at noon for this update. It is Wednesday, April 7th. This is update number 93. This forum is being brought to you live by PAC TV on Comcast, Channel 15, Verizon, Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. And today's participants include Ken Tavares, Matt Muratore, and they are joined by Dr. Philip Trafletti, Dr. Perry Potvin, Patricia Fry, and that concludes our panel. Each week we start with the chair of the Select Board for the town of Plymouth. Welcome back, Ken Tavares. We've had a busy week. We had town meeting on Saturday. Once again, town meeting members met remotely. We had 134 out of 135 participating, and our highest vote count of 128 town meeting members. What do you have for us today?
First, Steve, thank you for all of the work that you and those that were with you put into the town meeting. It ran very smoothly, and I think the town meeting members are getting used to doing it, although we all long for the day that we're going to be back in the same room together, and hopefully that'll be this year. But we certainly have to see what's going to happen in the next couple of months. But a great job, and the work of the town was completed with well-informed town meeting members. Today, I have borrowed a script. This morning, I was listening to Michelle Brady, our Cal director, as she made her weekly phone call. And I actually called her afterwards and said, Michelle, you've got some great news. I'd love to borrow your script so that we can pass this on to the audience for the, the View the COVID show. So I'm going to start with the first announcement that Michelle made, and that was she wants to make sure that the seniors in our community realize that they have got people at Cal that'll assist the seniors with information needed to pre-register with the state for a vaccine appointment, provide information for calling the homebound vaccination intake line, and answer any questions you may have regarding the vaccination process. If you feel a bit timid, you're not comfortable, please call Cal, get registered. The staff there is extremely helpful, and in no time flat, they'll have you registered and ready for, for that inoculation when your time is called. Also, she mentioned a couple of fun events that are happening, and I thought it was worth repeating that you can pre-register or register at Cal for a contest they're having. They're going to raffle off 2 Red Sox tickets for this season, and all you have to do is call Cal 508-830-4230 and register with them. And it sounds like a lot of fun, and it's a great opportunity to see a game at the right price. And the last piece of information that she wanted to pass on was that they are working with the Duxbury Council on Aging, and they're having a cooking demonstration where the first 50 people that call in will be given the ingredients, and you'll be able to cook with your Cal friends in Duxbury and in Plymouth. And again, call 508-830-4230 to register. Free ingredients and a great afternoon together to learn how to make a very special pizza. So a little bit unusual than what we usually talk about, but I think it's time to have some fun and get people in the mood for a great summer. Thanks, Steve.
Thank you. And that's Kenneth Tavares. He is chair of the Select Board for the town of Plymouth. He'll be here with our panelists, answer your questions, send them to plymouthinfo@pactv.org. Now we continue with our medical segment. We have 2 panelists returning. First, Dr. Philip Trafletti. He is an attending primary care physician for Beth Israel Deaconess. Welcome, Dr. Phil.
Good afternoon, Steve, and thanks again for having me on the show. I want to talk about what I think is some great news this past week that occurred regarding some of our vaccine effectiveness. I'd like to refer to this as beyond the phase 3 trials. When these vaccines were approved by the FDA for emergency use, they were in a thing called a phase 3 trial, but we're still continuing to do further research on the vaccines, and the information is extremely encouraging. The first study was done by the CDC, was reported in their weekly report last week, and they did a study where they followed 4,000 high-risk people. About half, 50% were healthcare workers, and the other half were essential workers. These are people who were in the process of being vaccinated. And what they were able to show was over this 13-week period, over 90% of these healthcare workers and other essential workers, when they were vaccinated, they got both vaccines, they were 91% protected against getting infected. So that's great. It's just basically the same information that we got from the shorter trials. The phase 3 trials were only required to be 2 months in duration for safety reasons, but now we're getting even more information down the road that this is still working well. The other great piece of information that came out of the CDC trial was that when they looked at people who only had 1 dose of the vaccine for Pfizer and Moderna, that 80% of them after 2 weeks were protected against the virus. I think that's a bit higher than we had anticipated from some of our earlier information. So I think this is extremely encouraging. If you're tracking the numbers now in the United States, I think by the end of the week, we'll probably have about 50% of the country will have had at least 1 dose. So you can start to see how much we'll be building towards that herd immunity that we need, so we can try to, have reduced numbers of infections in the community and have a safer environment for everybody. The second study I wanted to talk about was released by Pfizer, some additional information on 2,000 people that they had in their phase 3 trial. They continue to follow them beyond that 2-month period. They followed them out to 6 months. And what they found was that the vaccine was still over 90% effective for people that were followed for 6 months. So that means, we just have a longer length of time that we know the vaccine is working. And then they also reported that the vaccine was working against the South African variant. There was some exposure of their study participants to that variant. And so that's extremely encouraging again, that the vaccine is working against some of the newer variants. I know a lot of people are worried about how that might play out eventually. So great news on how effective the vaccine is. I get lots of questions in my medical practice about vaccines. And so one that came up this week, and I think it's worth emphasizing, is that people ask me, which vaccine should I get? And we've talked about this before in this show, and I'm sure other people have heard of it. And the recommendation is take any of the 3 vaccines, the Pfizer, Moderna, Johnson & Johnson. They're all virtually, essentially 100% effective to prevent the most important consequences of infection, which are hospitalizations and deaths. So I would take any of the 3 if you can get any of the 3. And of course, there's still issues with supply, but we're getting closer to having supply for everyone, and that will be coming. It may still take a few months for us to get to everyone, but take any of the vaccines; they're all great. Obviously, the Johnson & Johnson has the added benefit that you only have to go once. So for a lot of people, the logistics of just having to schedule the shot and only have to go once, I think that's a little bit of an advantage for Johnson & Johnson if you get it. The last thing I want to talk about is the issue of vaccine passports or vaccine certificates, which is an issue that's been going on in other countries, but it's going on here now in the United States. I was really delighted to see in the news this week, several universities in New England planning to require that their students be vaccinated before the fall semesters. That's Northeastern, Brown University, and Roger Williams in Rhode Island. So I think that's going to be a trend you're going to see continue. In the state of New York, they have started a new app called Excelsior app, And this is an app that people can download. It will connect them to the New York State database for the immunization record. And so it will create a QR code for your phone. And so if you wanted to go to, for instance, the Madison Square Garden for an event, you could prove that you're vaccinated. And so I think you'll start to see more of things going in this direction. The White House has said that they're not going to endorse the creation of any federal database. They're concerned about privacy and rights issues for folks. But I'm very excited that, obviously businesses and many other institutions will be, working on mandating the vaccine. Michael McConish, who I like to watch on CNN, he did a survey on Saturday, and 87% of his 30,000 viewers that responded, 87% were in favor of these vaccine passports. So I think you'll see more to come on that. So that's it for now, and I'll be happy to take questions later. Thanks, Steve.
Thank you, Dr. Philip Trafletti is an attending primary care physician here to answer your questions. PlymouthInfo@pactv.org. And we now welcome back Dr. Barry Potvin, and he is chair of the Board of Health for the town of Plymouth. Welcome, Barry.
Thank you, Steve. It's unusual for me to be here 2 weeks in a row, but the opportunity presented itself, and I'm happy to do it. So what I can do today in the 5 minutes that I'm allotted is to just update you on what's going on with the numbers here in Plymouth. And as I did last time, I do have something that I can show you that's a PowerPoint presentation, so it goes pretty quickly. Let me see if I can get this going. So I assume everyone can see this. Someone tell me if you can't. But down at the very bottom is the latest information that we gathered, which was made available to us last Thursday. If you compare that to what you see in the set of data above that, you can see that the number of positive cases barely budged. It's pretty much the same. Also, our average daily positive case rate per 100,000 stayed pretty much the same. And so did the positive test rate of 6.43 versus 6.35. So although we were seeing things going up at the moment, it looks like it's sort of plateaued and flattened out. We don't really know yet whether this will continue, whether they'll go up, whether they'll go down, or just stay the same. This is the graphic representation of this for Plymouth. And you can see that there's a very distinctive flattening out of the upward trajectory of the curve. What hasn't flattened out is this change in the number of red communities in Massachusetts over time. The last report said there was 55 of them. Plymouth is one. There's quite a few now in Plymouth County, and there's quite a few in Barnstable County also. So if you look at that percent test positivity for the red communities, the last time we did this, Plymouth was actually third in the state behind a couple of communities in Cape Cod. We're now 12th. And you can see that even two of the communities in Plymouth County have a higher positive percent test rate than we do here in Plymouth. There's quite a few that are having difficulty in Barnstable County, especially Barnstable and Yarmouth having trouble with that. So the Massachusetts state rate is 2.36. Why this is important is that most people feel that if you can get this number below 5, that it's safe to keep going with the reopenings. Those who are much more conservative about that say it ought to really be around 2. So far, looking at Plymouth County, we're sort of third on the list below Dukes and Nantucket, which have had a spike rate lately, and so is Barnstable. So these are the data that came out as of yesterday at 5 p.m. So in the United States, there's still more than 30 million cases total and 554,000 deaths. In Massachusetts, 609,000 cases and almost 17,000 deaths. And here in Plymouth, we're now up to 4,587. But you notice our deaths have not increased now for quite some time. That's a positive sort of thing, and it probably is a direct result of getting the older people vaccinated, because they're much more at risk, as you can see at the bottom, for perishing from the COVID-19 if they get a severe infection than the younger people are. This is the latest data on the variants. And I got to point out that, this changes a lot and it changes weekly. What's been happening lately is this UK variant has been increasing quite a lot. There's 977 known cases of that among the ones that have been tested so far in Massachusetts, and 16,000 or so in the United States in general. And although they haven't updated this for quite some time, there were 2 in Plymouth County. There's probably more than that at the moment. The South African variant doesn't seem to be a huge concern. There's 386 in the US and just 12 in Massachusetts. The Brazilian, although it's about the same in the US, showed about 82 cases, which are a pretty good sized jump in Massachusetts. And of those, 20 were in Barnstable County, and was apparently the source of an outbreak they were having down there. All of those are known to be more infectious and easily transmitted, which is part of the reason people get worried about slackening off on some of the safety protocols and people getting together in larger groups and not wearing masks as much as they used to. So we're still worried about that, just because if these are becoming predominant, they are more easily transmitted and they're a little bit more infectious. The UK strain is thought to be becoming predominant and may be responsible for most of the new cases within the next month. At least one case, the Brazilian, was found to reinfect people who previously recovered from the more common strain that we've been fighting now for more than a year. Skip that. This is the good news for sure. If you look at the municipal vaccination data, which comes out again every Thursday, so this goes back to last Thursday, and you look down at the very bottom, you see that here in Plymouth, we have 20% of our population fully vaccinated and about 35% of them with at least 1 or 2 doses. So some of them are not fully protected yet, and the ones that aren't are the 16%. The rest of them are fully protected. And even better than that, if you look up at the older age groups, the 75 plus and the 65 to 74, the ones that have got 1 or more doses are 87 and 80%, and the fully protected ones are 67 and 41. So this has changed pretty rapidly, and it's good news, and this is probably a large measure of why we're having the death rates, the total number of deaths increasing any longer. They've really been flat for some time. Now the ones that are 55 and older can book vaccination appointments. So we should see those numbers going up pretty soon as well. And there's also good news with the vaccination sites. As you can see, for the first time, we now have a CVS down on 3A State Road in Manamet, which is now open and giving vaccinations. They weren't open before. There's also a new one in Carver that wasn't open before. And there's a new one down in Lakeville and a new one in Abington. So at least on the terms of the federal pharmacy-sponsored vaccination sites, and they get their vaccine supply separate from the state through the federal government, there is more sites where you can get vaccines near to Plymouth than it was the case before. The rest of the stuff hasn't really changed. Some of you may know that Fenway Park is no longer being used for vaccinations. Instead, they're using the Heinz Convention Center. And that's where you might have noticed Governor Baker getting his shot, I think, on TV yesterday. I was told that the Kingston Collection Mall is still not out of the question. Apparently, they're still looking at regional sites. I think they said there was 6 that had been approved recently, but they couldn't open because there was no vaccine to give them. And there's another 7, which probably includes the Kingston Collection Mall, that is in the same sort of boat, but those are being approved on a sort of a rolling basis, but still there isn't any vaccine to give them. So even if we get approved for the Kingston Collection Mall, we probably couldn't open until the vaccine supply improves, which hopefully it will by the end of the month. I wanted to go through this again because this started on March 22nd. The one thing that we've been concerned with on the Board of Health is the one down in the bottom. Gathering limits for event venues, which include things like weddings, have been relaxed to accommodate 100 people inside and 150 outside. The private limits stayed pretty much the same, but the Board of Health, looking at what was going on in Plymouth and our red status, which is high risk, decided it would be prudent to limit inside event gatherings to 60 and 100 outside. We certainly realize that this complicates life for people who have planned weddings in the next month or two, but we're hoping we'll go back to yellow soon. Maybe that flattening out of our curve will actually start to decrease, and then we'll immediately consider whether or not we can go back to the state guidelines for that. This is a list of, they've changed for the comorbidities. So what's changed here is that they added cystic fibrosis. They added being overweight, not just obese. And they added smoking, current or former smokers, and they define that as anyone who has smoked 100 or more cigarettes in their lifetime. So that's a lot of people, I'm sure. And they also added type 1 to the previous list of type 2 diabetes. So there's more people eligible. And so if you're 55 or older, or if you have any one of these conditions you see listed here, you can make appointments immediately. And you certainly should register with the state service that will provide you with callbacks as soon as your name comes up among the eligible people. As of April 19th, both here in Massachusetts and nationwide, anyone above the age of 16 is eligible to start registering to make appointments. There's going to be millions of them. So there's going to be a huge number of people. We still don't quite have the vaccine to supply the need, but you can register yourself and your name will come up as soon as there's an opening somewhere nearby where you're living. And we certainly still encourage everybody to get vaccinated as quickly as you possibly can. It would be a big help if you can do that. So that's what I wanted to share with you today. And I'll be certainly able to answer questions. And again, on a week from tonight, starting at 4 p.m., the Board of Health meeting will be broadcast by PAC TV, and we'll go into more detail at that time. Thank you, Steve.
Thank you. And that's Dr. Barry Potvin. He is Professor Emeritus, Yeshiva University Department of Biology. He's also an epidemiologist. And at this point, we move on to our educational segment, and we welcome back once again Patty Fry. Patty is coming to us today as principal of Plymouth South High School. Welcome, Patty.
Hi, Steve. Thanks for having me today. I'm here with my high school principal hat, formerly assistant superintendent. So it's good to see everyone. I'd also like to thank Dr. Potvin and the Board of Health and the school committee for all their support, as well as the entire community. It's been a complex year, to say the best, but I think on behalf of the schools, we can see the light at the end of the tunnel. I think, as everyone knows, our elementary schools, I'll speak some district-wide things as well, returned to school on the 29th. And I think a lot of people saw first day of school pictures shared all over social media by families. Happy to go back. It's been going well. And our secondary schools, 6 to 12, are going back on Monday, the 12th. So we're very, very busy. I feel like we should have tape measures taped to our body because we're kind of resetting up our schools. Our custodians are working so hard with our administrators to get our spacing correct. We are moving from a 6 feet distancing to 3 feet from edge of chair to edge of chair. And we've been very creative with our spaces at the high school level. We have over 500 or so classes offered with our breadth of programming. And some of our classes will remain with that 6 feet spacing. So for example, at Plymouth South, we have about 28 classes that are over 27. So we've been able to be creative with those, and kind of, they might be taking place in the cafeteria or in a larger space, things like that. So we've been working hard on that, as well as our lunch program. We're going to be modifying, a lot of schools on the South Shore are doing this, that at the high school level, students will be kind of having a lunch as they depart the building. And we have a number of athletes that may leave and come back for practice, or we have spaces in the building. So at lunchtime, we still need to make sure we have 6 feet spacing, and at both North and South, that's a little bit of an issue. So we went with this model with the school committee's approval based on guidance from the Mass Department of Education. As I shared the kind of light at the end of the tunnel, a lot of our staff have been vaccinated. They're either complete or heading toward their final stage. Those that were interested, it's amazing. It's like a completely different look. People are smiling again and very happy and excited and looking. They miss the kids, so they're excited about that. Also, it's something that was new to me is a bunch of our seniors have appointments. They've shared with us. And with the staff. So it's kind of nice to see them kind of jumping on board because we have kids who are, 17 and 18. And we even have a few students who are fully remote because of medically fragile conditions, and they've received their vaccine and come right back to school after the 2 weeks from the final shot. So that's been exciting. And the final kind of update is really we're pushing forward with our end of year festivities and activities and following all local guidance and guidance from the Department of Education. For example, we are having a graduation for both high schools at our fields outside on June 5th. We've actually picked a rain date as well, and that's a great day to celebrate for the community. And many of you may remember last year we had a wonderful event down the waterfront that looked different, but I helped facilitate all of it with Dr. Maestas, and our entire community was behind it, police, fire, DPW. So now we're going back to our schools, but there is specific guidance from DESE that our kids will be 6 feet apart outside. And we're looking at pods for families to sit in, and we haven't decided on tickets and things of that nature, but we'll be having as many people in our facilities as we're allowed, and we can handle distance with that 6 feet. So that's something that's going on. We're really pushing to have all our senior events in person, and we have pretty special nights at both schools from our scholarship night, which is incredible generosity from the whole community. Some of you have been to it before. We're going to have that. Each student will be allowed 2 people to attend as of today. But we really want to have it in person for the kids because that was missing a little bit last year. We have a senior athletic awards night. We have a class day. Each school handles it a little different, but they mirror one another. The big discussion is we always have a junior prom, and the kids have voted for the junior prom, the current juniors, to go have a prom next year in the fall. They're hoping things will be better and have it be a real prom. But we're working with our seniors at South High School to have what they're going to call kind of a seniors night out. Class of 2021 and done has become their logo. And we're going to be on the field. We're going to do waves of children to keep it below the numbers that Mr. Potvin talked about. So waves of, say, 75. And we're going to have some distance food trucks, a DJ. There's not going to be dancing, but we're going to have a red carpet. So our seniors all had their prom gear purchased and ready to go when the shutdown happened. And it may sound crazy, but they'll never have another event like that in their life. So we're going to formal wear and kind of make it work for them. So I'm working with a group of the seniors, and I have superstar class advisors who are helping with this, but we're gonna have white lights, and it's gonna be on the football field. So in distanced, and we have already about 40 teacher chaperones willing to help to make sure the kids are spaced, no dancing. But I think they just want some closure, which is kind of neat. So we're working on that here and getting the final details. And then kind of a final shout out, it's National Assistant Principal Week. And as many of you know, I've been a principal in Plymouth since 2004, and I've worked with the same 3 vice principals, and Carolyn Whittle, Mark Fornashari, and Mark LaRanger, and I just wanted to thank them because I couldn't do anything without them. Even when I was at central office, they still helped out a lot. So that's kind of where we're at, and I know everyone's excited, and we're kind of going with the theme Better Together at South High. We're ready for everyone to come back, and the kids have been phenomenal, so they're ready, I think. We haven't had one student elect to go from the current hybrid to a full remote plan. So we're confident with that data since the school committee voted on whatever night that was. So.
Thank you, Patricia Fry, and she is the principal for Plymouth South High School, and we do have questions for all our panelists, but first we're going to go to Plymouth State Representative Mathew Muratore, who joins us each week. Matt, what do you want to tell us this week about what's going on at the state level?
Hey, Steve, how you doing? First of all, Patty, it's nice to hear the kids really getting back into things and getting outside and doing graduation. So it's good to hear. We're starting to get back to somewhat of a new normal. So that's great to hear. Love the information from all the panelists, especially Dr. Potvin. The local information is very helpful. Steve, I just want to go through some quick numbers. I know Dr. Potvin went through a lot of this, but I want to just put it in context a little bit too. In the Commonwealth, and I've talked about this before, it's 6.9 million people we have in the Commonwealth. And right now we have received 4 million vaccinations. Of those vaccinations, 1.5 million people are fully vaccinated at this point. And we've had, as of today, with today's numbers coming out, will be over 610,000 people who've been infected. And the deaths have been up to over 17,000 at this point. But as Dr. Potvin Dr. Potvin said, the numbers are actually going down for the deaths. And that's the simple reason is, as we talked throughout all these shows, particularly in the beginning, the deaths were caused by folks that were 65 and older. And when you start looking at the age group of vaccinations, in the Commonwealth, we have close to 500,000 people who are 75 or older here in the Commonwealth. And to date, 340,000 of those have been fully vaccinated. So that's about 82% of those 75 and older. When you start looking at the 65 to 74-year-old bracket, we have 680,000 folks in the Commonwealth at that age bracket, and 362,000 of those folks have been vaccinated. So that's almost fully vaccinated. That's almost 50%. And then when you go to 50 to 64-year-olds, there's 1.4 million people that fall in that category. Again, 337 folks have been fully vaccinated, but as just been mentioned, that the 55 plus age group has just opened up. So you'll see that number start going up. And interestingly enough, when you start looking at the 30 to 49-year-olds, it's 1.7 million people under that category. And there's still 318,000, almost 319,000 folks who've been vaccinated in that age group as well. And even the 20 to 29-year-olds, there's over 1 million people in that category, and they're up to 121,000. So the numbers are looking really good with the vaccinations coming in. We actually have over 445,000 vaccinations coming in directly to the Commonwealth this week, not including the federal program, which is another 300 and something thousand that's coming in through the federal program. And as Dr. Potvin Dr. Potvin said, I can't say that word today. As he said, there are more CVS pharmacies to the federal program that are being added because more vaccines are available. So I think that's why, as you know, Governor Baker indicated several weeks ago that on April 19th, the vaccination will be opened up to everybody. And the president has now said the same thing, that the entire country will be open up to that. And that's because the vaccines are getting more and more readily available. A month ago, we were talking about maybe 150, 140 vaccinations coming into the Commonwealth. Now we're up to almost 500,000 and growing. So, so we are getting there. We're still hopeful, as Dr. Potvin indicated, that we may see a regional site here in this area, particularly the Kingston collection. So, hopefully the next couple of weeks we'll hear something about that. But the process for vaccinating is working as well on the website. So if you want to go ahead and get an appointment ready, you can do that no matter what category you're in. You can do that now. Get on the list, and you'll be emailed back or texted back when your appointment is going to be. I also just want to say that the infection rate, although Plymouth is a little bit higher, but in the Commonwealth we're still running about 2.5% positivity rate for the 7-day average, and the hospitalizations are still running around 725. So again, it's because we've been vaccinating the older population, 65 and older, first. That's why you're seeing the hospitalizations are not going up and the deaths are not going up. As a matter of fact, they're either leveling or going down. So that's really some good news. With that said, though, we did have Easter, we did have Passover, and the fear is now that there may be an increase over the next 7 to 10 days. So we'll be closely monitoring what's going to happen over the next week or so. But the more vaccines we can get in people's arms, the better we'll all be. And that is the update from the state. Steve, back to you.
Tori, next week we're going to be joined by Karen Keene. She's the Director of Public Health for the town of Plymouth. Also, Michelle Brady, she is the Director of Elder Affairs. Amy Naples, she's the Executive Director, Plymouth Area Chamber of Commerce. And today we're going to go back to our panelists. We have a series of questions from viewers. We're going to begin with Dr. Triffletti. Phil, we understand that there's been information gathered from people being vaccinated about their experiences and side effects. Would there be any initial data or information that could be shared? And in particular, what would you say to the anti-vaxxers who question whether or not they should be vaccinated?
Yes, thanks, Steve. I think as we've been putting together these large vaccination programs, as far as I'm aware, nobody's died of getting this vaccine. I think the biggest risks are really people that have, allergy, allergic type reactions. But most people only get mild symptoms, and the vast majority of people do extremely well. And I think people who are not vaccinated, especially those people like Matt was pointing out, older people with comorbidities, I mean, the risk of getting the infection is extremely high, and the risk of death even from these infections. And I think even for younger people, you're seeing more and more research being done to show that there's carryover effects from infection, so that even if you don't die, you might have some pretty miserable symptoms to live with. So I think you clearly want to avoid, getting infected, whether you're a young person or you're an older person. And, I do feel that the vaccines are still proving to be, extremely safe, extremely effective. So, I would still encourage everybody to get the vaccine, and always, again, talk to your primary care doctor about getting the vaccine. If you have any hesitancy, I think they can help you sort through any issues you might have.
Thank you. And now going to Dr. Barry Potvin. Dr. Potvin, there's been a lot of chatter on social media related to people questioning the return to school for middle and high school students. So do you have any words to offer, given that the numbers in Plymouth were red for a couple of weeks, and this week they remain kind of the same? And we heard from Principal Fry about this upcoming gathering. What about large gatherings, Dr. Potvin?
Well, about the schools, first of all, yes, the middle and high school students are all being offered the opportunity to come back for full-time learning again as of April 19th. So, that's actually starting a little bit sooner than other places. And that certainly is a big benefit to the students coming back, because they're under a lot of emotional and psychological stress, in addition to having difficulty, some of them learning remotely. But obviously the parents, if they wish to, can still keep their students on remote learning. My personal opinion, and I keep saying this, is that the schools have done such a fantastic job at providing a safe learning environment for the students. They obviously carefully monitor mask wearing. They carefully monitor physical separation of the students. They also monitor all kinds of other things. And obviously now the teaching staff and the other staff members are getting vaccinated in large numbers. So I still maintain that the schools are probably one of the safest environments that there is. You have much more risk of becoming infected just in the community at large. And obviously, if you're a school student and you're in the school, you're in a pretty safe environment. But if you're not in the school, well, you could be going anywhere. You could be with other friends doing things too close together, not wearing masks, and it puts you at much more of a risk. In terms of the large gatherings, it's still the same story. The more people you're with, especially if they're not wearing masks, the more risk there is that you will become infected. You don't know who's been vaccinated and who hasn't been vaccinated. Just because somebody has no symptoms doesn't mean that they're not carrying the virus and capable of spreading it. So you still have to be careful, especially in large gatherings and especially in indoor settings.
Thank you. And now we're going to go back to Patricia Fry. Patty, viewer writes, what's the response you're hearing from teachers, students, and families about returning full-time to Plymouth South High School?
Parents have been very communicative. I try to send out communications a lot. We try to keep our social media updated. And I think one thing through this is people are not afraid to ask the questions. So kind of like in the fall when we returned, people will call and air their fear, and we kind of explain what it looks like. It's hard through a newsletter to get to the nitty-gritty of what the concern is or what the issue is, but So we've had a number of calls of that nature. But overwhelmingly, people are thrilled about some structure for the kids. They are really struggling, as Dr. Potvin said, on many layers that 15-year-olds who've been going to school their entire life aren't used to having free time, if that makes sense. So how they use that time, what it looks like, caring for younger siblings is very real, working full-time jobs. So I think the kind of normalcy that school brings, I think parents are very happy about overwhelmingly. But there are still fears and nervousness. We have made a change in the last week that gaiters are no longer allowed, just masks. We provide those as needed as well. And we've gotten great feedback on that from families. And I think they're just looking for, the biggest fear is a little bit surrounding the academic workload. And I actually have a faculty meeting today with my staff, and they're very, since the vaccines, the teachers turned a corner. It was a very clear, you can see it almost. But I think a parent said to me, and it was a great point, that April 12th, when we start, is really, it's the first day of school again. These kids haven't been in a regular school environment since March 13th of last year. And there's been a trauma, and it's real. And we're working with the teachers to make sure they don't say, okay, all this is due, all that's due. So I think parents, everyone was celebrating. It was the last remote Monday this week, which it's not, I think people realize the value of schools even more than ever now. So to answer the question directly, Steve, I think people are happy, and people who do have concerns meet with us and talk to us, and we work through we brought people in for tours after hours, showed all the different measures that are in place, and we'll do anything to make our population feel comfortable. And that's our job. So
Thank you,
pretty
Patricia
positive.
Fry, Plymouth South High School principal. Representative Mathew Muratore, viewer writes, what's the outlook for this summer based on our statewide numbers?
Yeah, it's a good question, Steve. We actually had our monthly meeting with the governor, lieutenant governor yesterday, and we were talking about that. And his prediction is that we should have, with the amount of vaccines that are coming and are projected to come, the increases, that we should pretty much have everyone who wants a vaccination vaccinated by the middle part to late June, and to reach that herd immunity level of 4.1 million. I mean, that's really the goal at this point. We're at 1.5 fully vaccinated, so, we're getting there, but he really feels that by mid to late June, we should be able to reach that herd immunity. Now the scramble is trying to get more people to get vaccinated, and convince people that that's the best thing to do. So that's a little bit of the concern at this point.
Thank you, Plymouth State Representative Mathew Muratore. We're now going to go back through our panel and have them give us their closing statement. And we're going to begin with Dr. Philip Trafletti, attending primary care physician, Beth Israel Deaconess. Phil, what do you want us to remember today from this presentation?
Well, the first thing is, we've got great vaccines that work very well. So, I highly endorse people go out and get them. I realize, it's still a little bit of a problem with the supply, but, do your best and keep at it. And also with the mitigation strategies, don't forget, I still have patients who've been infected in the last 2 weeks. One was hospitalized. She did well, but she was very sick. So the virus is still out there in the communities. A lot of us are still not protected. So please, do all the right things. Wear your masks, do the social distancing, try to avoid gatherings indoors where there's no masks. I think that's really the primary thing. And coming into good weather now, we can do a lot more outdoor activity. We can dine outdoors and do better spacing outdoors. So enjoy the spring, and look forward to seeing you in 2 weeks. Thanks.
Thank you, Dr. Philip Trafletti, attending primary care physician. Dr. Barry Potvin, we've had a lot of talk today about what can happen during the holidays. I just actually was with someone this morning who shared with me that one of her neighbors just found out that he was positive and had his entire family, 3 adult children, grandchildren with him, and now they're dealing with who's going to be tested. And so people are still, unfortunately, testing positive right here in Plymouth. What do you have today for closing thoughts?
Well, yeah, that's true. I also know somebody personally that I just found out was recently infected, as was his son. And so fortunately, it's just a mild case and they're recovering, but it's still out there with us. I wanted to point out that last week was actually National Public Health Week. And it's appropriate at this time to say that everyone should thank public health officials, epidemiologists, healthcare providers, and especially the scientists that work feverishly with huge hours to get us these vaccines that are helping us get out of this horrible situation. I did want to point out that also in connection with something that Dr. Phil said, that both the Moderna and the Pfizer were tested, and preliminary data does seem to indicate protection that lasts at least 6 months. Could be longer, but 6 months seems to be one thing that they're pretty confident of right now. The protection gives you about 90 to 95% protection against not only just getting even mild illness, but also probably about the same protection against actually harboring an asymptomatic infection that could certainly be spread to others unknowingly. So that's important too. I think you have to keep in mind still as a take home that there's still people out there that may be asymptomatic that still harbor the virus. There's nobody from the business community on today, but there sure have been an awful lot of people going into restaurants lately. They've been quite crowded. I think we're just opening up the outside dining now. And I would emphasize that it's a lot safer for everybody, whether you're vaccinated or not, to opt for the outdoor dining if it's warm enough and it's pleasant enough to do it. So remember that you'll be with people who are not wearing masks because they're eating and drinking. And everyone will be physically separated enough to provide some protection. But it's obviously better if there's air circulation, as is the case outside, as opposed to inside. And yes, we're still waiting in the next 2 weeks to see what's going to happen with respect to the gatherings that occurred over Easter and Passover. And we're still waiting to see what's likely going to happen with the ongoing problems with the variants. But we're all hopeful. I think that the summer coming up is probably going to, give us another respite from these horrible things that have been going on, so that we can at least resume some of our normal activities, even though we may still have to wear masks and be a little bit careful about what we're doing around other people. Well, thank you for inviting me, Steve, and thank you for all PAC TV has been doing to help not only this show, but also the Board of Health meetings that are also broadcast on Wednesdays.
Yes, certainly. Thank you. Special shout out to Donna Rodriguez, who is here in the studio with me, as well as her staff in the control booth. Patty Fry, I was interested in hearing about vice principal recognition, since, as you know, I have a vice principal near and dear to me, along with a teacher. I spent Easter with them. We were outside, we were socially distanced, we were wearing masks. But what can we do as members of the Plymouth community to support administrators, teachers, and students?
Yeah, I think the vice principals often go under the radar, and they like that sometimes. They deliver a lot of bad news daily. But this year, even more so, I say jokingly a lot that this year, I've been a principal for a very long time, and everything takes triple the work to do, and it's all worth it. But if you have a lacrosse team playing, it's quadruple the work. When we had awards, we had National Honor Society induction in person, which was great for families. That was triple the work. And the vice principals, it's the same way. And the principals, I mean, it's what we do and we love it, but they really have a labor of love for these kids and they want them back. They know all the different issues that they're facing and behind the scenes. And I think the other big group are the guidance counselors that are often missed. The things they've done this year with the amount of students that we have to quarantine and for things that happen outside of school. If someone was at an event and then they're quarantining, there's a communication that goes to the 8 different teachers at the high school level. And those integral people make all the ducks kind of line up in a row. So I think just support and get us past this. The medical community, we can't thank enough, but I think we're ready to keep moving forward. And I think the kids are overlooked a little bit because they really haven't missed a beat. In August, when I was assistant superintendent, a lot of our staff were worried the kids were going to ignore the masks, and they have taken it very seriously. They really have. I mean, we always have situations that come up. We're not perfect, but the kids have stepped up in some very, very hard times. So I just would want to thank them and thank everyone else. So.
Thank you, Patricia Fry. She is principal, Plymouth South High School. Mathew Muratore, our Plymouth State Representative, your closing thoughts.
Yeah, just going on what Patty just said too, I think many times in this show early on, particularly, I said that the kids in this community have really, we could take, examples of what they've done because they've been so resilient and really following the rules that they had to. And I think a lot of the adults could have followed their lead. So kudos to the school. But there are a lot of heroes in this whole situation, and, teachers and the staff of the school and medical people, as Dr. Potvin indicated, grocery store workers. There's so many people, but my fear is that we're going to forget about them, and we can't. We have to remember when this is over that these folks are still heroes, not just for a short period of time. And a quick little story, I was at my daughter's basketball game in Braintree the other day, and they were limiting the people coming into to the basketball court. It was indoors, and there was a woman who was a nurse, and she wasn't allowed in because they were over just at the capacity. And she said, "I'm a nurse, does that matter?" And the guy at the door says, "Not anymore." And that's kind of sad. We can't be saying that. We got to remember that these people stood up for us, whether you're in the grocery store, medical field, teachers, whatever. They were out there, and we can never forget that. With that said, I do know that, again, April 19th is coming in 12 days. The president has indicated that 90% of the country will have vaccinations available to them within 5 miles. So there'll be no excuses for anybody to be getting vaccinated. So we just continue to need to hang in there. And as Dr. Triffletti, once said, controlling COVID is good for your health. It's good for the economy, and it's good for the schools. And we need to continue to do that. We're getting there, but we're not there yet. We'll see you next week, Steve.
Thank you, Plymouth State Representative Mathew Muratore. Now we're going to return back to where we began with today's presentation. Ken Tavares, Chair of the Select Board. Ken, what do you think? We've had quite a bit again today.
It's been an excellent panel once again. I appreciate the words from everyone that's participated today, bringing hope, which is something we haven't had for the last year. But also I hear that it's all tempered with, we still need to go by the rules. And I think that's the hard part. As we see more things open up, we feel that we can let our guard down, and we can't do it. Matt said it best. We can't forget what we've been through, and I think it's very easy, to do so. This past weekend, I was talking to a Plymouth resident that has a phenomenal amount of energy and can do 100 things at the same time and do them well. And he said to me, I early on got the virus. And he said, I'm a long hauler. He said, I still have a ways to go. So I think as we want to take more liberties, we need to remember that there are a lot of people out there that are living with long-lasting impact of this virus. We just can't go out there and do what we want because it might feel good at the moment. So, following the advice of everyone that has spoken today is, begin to live again and as you want to, but you have to temper it. And I think if doing so, we will, as I've often said before in this program, we will defeat the virus. But we can't do it haphazard. We've got to put all of our efforts into it. So with that, Steve, thank you. Thank you to the panelists for delivering the good messages, and have a good week, everyone.
Thank you, Kenneth Tavares. He is Chair of the Select Board for the Town of Plymouth. Thank you to all of you who have been watching and supporting us as we just completed our 93rd COVID-19 update for the Town of Plymouth. I'm Steve Triffletti, Plymouth Town Moderator. Good day.